No. That was the wrong way. Now I'm going to list the steps of how to properly do the Heimlich maneuver. Step 1. You will ask the following questions. Hey, are you okay? Can you cough? Can you breathe? Can you speak? Step. You will comfort the victim. I can help you. Step 3. Go behind the victim and you create a T position with your feet to keep balance and stable just in case that person falls. Step 4. You will find the victim's belly button as a landmark. Step 5. You will place your dominant hand, you will place a fist above the landmark, and then you will place your non-dominant hand over it. Step 6. You will go in and up. In and up. Hey, are you okay? You kind of want you get the ED and come back.
Oh, hello. What? So much.
I'm going to show you guys how to perform CPR. CPR stands for cardiopulmonary resuscitation and is to help circulate vital blood flow to the heart and the brain. So step 1 would be secure the scene. You need to make sure the area around you is secure enough for you to perform CPR on the victim. And if it is, then you go ahead for step 2. And it is shake and shout. You have to check for responsiveness because you don't really know if the victim might be unconscious. Right? Do shake and shout, and you would most likely say, hey, are you okay? And you tap on their shoulder. Step 3 would be to activate EMS. So if you would ask someone to get the AED, and you would ask someone else to call 911 and come back. Step 4 would be open airway. You have the ABCs. A stands for airway. So you have head tilt, chin lift, and you have jaw thrust. Head tilt, chin lift is what you would normally use if you don't suspect an injury. And if you do suspect a head, neck, or spinal injury, then you use jaw thrust. So we're going to use head tilt, chin lift, and you are to place your hand on their forehead and your fingers on their jaw to open their airway. We're looking for the rise and fall of the chest. We are feeling for the warm air exchange, and we're listening for the breathing. So 1 and 2 and 3 and 4 and 5. We've determined no breathing, so we're going to go ahead. Breaths, 2 rescue breaths. You pinch their nose and seal their mouths and give 2 rescue breaths, and you do it gently so that you let the air come out. Step 7 would be to do a pulse check and a body scan. We need to see if the body is responsive to any kind of movement, and we need to find a pulse. So the way we would do that to find the pulse is make sure your airway is open, and you would place your hand on their chin and from their chin to their Adam's apple, and then you would go diagonally up to find the pulse. And you do a body scan and a pulse check for 10 seconds. So 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9. You are to use your entire weight over the victim and begin compressions. So you are to do 30 compressions and 2 rescue breaths for 5 cycles. You are to do, for the last step, a pulse check and a body scan again. You do it for 5 seconds this time, and you place your hand on their chin down to their Adam's apple and diagonally up for the pulse, and you do 1 and 2 and 3 and 4 and 5.
And then at my funeral they'll say he died doing what he loved. What was that? Dying.
That was good. That was the perfect blow. I thought you were gonna be in the national,
Now you and I are doing CPR.
I'm in that honest class.
The victim is on the phone.
No, wait. Alright, just wait for me in the offices. I'll come outside right now.
Okay,
Cuidadito con la respiración boca a boca, okay?
Okay, so lo que tú vas a hacer es go like this.
Okay, wait, I'll just start calling 911. And then you just start.
These are swimmers' pets.
Okay.
Did you get that?
I don't think to do the Heimlich remover.
It's not remover.
Go again.
Yeah.